Hello everyone. I hope you can see the slides and you can see the transition as well. So I'm Dr. Ayan Dey, and I want to thank Hinduja to give me this opportunity to connect with all of you. So today I'll be talking on something very relevant, which in our day-to-day life there are a lot of myths which surround kidney diseases, and I thought, what better way to connect with everyone than try to break a few of these myths as we go along. Yeah. So basically, see, myths and misconceptions are a bit different. And it is important to understand the difference between the two. Misconceptions are something that can be sorted if you make someone aware of what the situation is. Myths and folklores are something which kind of get stuck, and despite doing everything, these myths linger on in the society, and it's very difficult to break off from them. So to understand what those myths are and how to break them apart, we need to know about kidney diseases. And to understand kidney diseases, we need to know what the kidneys do. Unlike what we all think, that the kidneys are just making urine and making you pass your water and the toxins, there are a whole lot of other things that the kidneys do. Of course, there is excretion of the waste products. There is regulation of the water balance. So in summertime, you pee less because you're conserving water. When you're feeling cold, you pee more. So that's how the water is maintained. By doing that, it also regulates the mineral contents in the body, like sodium, calcium, potassium, and a whole lot of others of them. It also manages the acid base pH of our blood. And it's one of the most critical organs and one of the most fascinating organs which does this every second, every minute of your whole life. There is excretion of the medicines and the toxins which you take in. It also synthesizes a hormone called as erythropoietin, which helps in keeping your hemoglobin to the normal levels. And it activates vitamin D3. Of course, you get the vitamin D when you are exposed to sunlight or you take medicines. But to activate that, the kidneys play a very important role. So any of these problems, when a kidney disease starts getting manifested, any problem in these start manifesting. So what would you notice? A reduced urine output, easy fatigability, nausea, swelling in the feet, either an increased or decreased urine volume. Too much of passage of urine at night can sometimes be an early indicator, though not all the times. If there is a change in the color of the urine, if it's brown or red or pink, and sometimes puffiness of face, shortness of breath, and unexplained itchiness. These are some of the more in the later stages. So let's delve into some of the common myths and let us see if over the next 15 to 20 minutes or so, we can debunk a lot of these myths which surround. I'm pretty sure not all of us carry all these myths, and this talk is generally directed to the general public. I do see some of my patients on the panel as participants. I see a lot of people, a very heterogeneous crowd, but I've tried to keep it the myths pertaining to everyone in the society. So some of them might not be relevant to you, some of them might be. So just bear with me. So the first is kidney disease is rare and not a serious condition. With growing awareness, I'm sure this myth is going down, but it is an important one, and I've kept it first because a lot of people think, oh, kidney diseases is not that common. No one I know has a kidney disease. So there is no point in checking it once in a while. You will be surprised that there is a rising prevalence of kidney problem in India. India being the diabetes capital of the world, hypertension being so high. Along with it, kidney diseases also get manifested because of both of them. And unfortunately, the patients are getting younger and younger, and kidney diseases are getting manifested. So that is the number one thing. Kidney disease is present. 1 in every 6 person probably has some form of kidney problem, either early or late. So you have to be aware that there is some problem. And as I go along, I will show you how to probably check it once every 1 or 2 years as you age, just to make sure that everything is fine with you. Second, then we'll shift completely to another myth that once you start getting a kidney disease, there is nothing you can do about it. Of course, there is a lot that you can do about it. Knowing a kidney disease, you have a kidney problem is the first step. So be vigilant about it. Meet your general practitioner, meet your nephrologist whenever you encounter any issues. And there are a whole lot of things that you can do to control the kidney problem which has started setting in. And these are a few things which I'm sure every doctor would have told you at one point or the other, because the general dictum remains the same, that you have to stay healthy. You control your blood pressure, control your diabetes, keep your weight in check, eat a nutritious diet, exercise frequently, don't smoke, and so on and so forth. Now, this is something which we encounter very frequently in our outpatient department, the query. So I've put this in. Kidney disease means one kidney is not functioning properly. Now, you must have heard that there are some people who donate their kidneys to their loved ones. Also, there are a lot of people in the general public who are not even aware, but they are born with a single kidney and they do absolutely well their whole life. Yes, only one kidney, if it's not functioning properly, sometimes the blood reports and the urine report might not pick up an underlying kidney problem. So it is important that in risk situations, I'm not telling in everyone, in people who are at high risk, it is worthwhile to get some basic investigations done, because the kidney report starts worsening generally when both the kidneys start getting involved. So if you have recurrent stones in one of the kidney, or you have had an infection in one of the kidney, and that kidney has started working less gradually over a period of time and is getting smaller and smaller, if the other kidney is working normal, you might not encounter a problem at all. But if you are vigilant about it, you keep a watch on things, like I said in the previous slide, monitor your blood pressure, sugar, then the probability of the other kidney getting worse as well goes down significantly, and hence the longevity of both the kidneys as a whole increases. Fourth, this is also very common. You would know if you develop kidney disease. A lot of my patients, a lot of people I encounter with tell me, oh, we don't have any symptoms, so surely we won't be having any kidney problems. Now, that's not true, because the kidney disease manifests slowly and steadily over a period of time. There are various ways in which the kidneys can get involved. Something called as an acute kidney injury, wherein you have something suddenly going wrong with your body. In India, one of the common causes is, suppose, some toxin or a snake bite, or you have massive diarrhea, or someone has unfortunately a heart attack and the kidneys get shut down within a span of few days. That is different. In that case, the doctors are anyways vigilant about what's going on with the kidneys. But the other form of kidney problem is called chronic kidney disease. And sometimes, as you can see in this graph, it starts from normal and then the risk factors set in, and slowly and steadily the percentage of both the kidneys functioning starts going down, and you might not encounter any symptoms. So it is not a dictum that because you are peeing well, you are otherwise okay, that you do not have a kidney problem. Also, the other spectrum is also true. There is no way to know you have kidney disease until it's too late. No, there are some subtle signs which start getting encountered early, and more often than not, we try to pass them off as something innocuous. Though this does not happen in everyone, I am not here to panic you for every little symptom that comes up to think whether you have a kidney disease, but just to be aware that these are few things which can be an early manifestation of a kidney disease just starting, which is passing more urine than normal. That can also indicate diabetes, so that is something you need to keep a watch on. Nocturia, which means you're passing more urine at night. Of course, this is not just a kidney issue. It can sometimes be that as you are aging in an elderly male, you're starting to have some prostate problems. So that also can be the issue. Higher than usual blood pressure initially can be one of the earlier indicators that the kidneys are wrong. Unexpected anemia, and this is for also the doctors and also for my patients to be aware that if, as I told you, that one of the hormones which is produced in the kidney is erythropoietin, and that in turn increases your hemoglobin. So to flip it on its head, if someone has a lower hemoglobin than normal persistently, then one of the tests that one should do is check for the kidney function. Easy fatigability, lassitude, and tiredness. Microalbuminuria, or passing small amounts of protein in the urine, which can then be quantified by your doctor or your nephrologist. And mild elevation of serum creatinine, which is a blood test to check whether you have any kidney problem. So these are some of the many symptoms I have not put all of them, but if you start having swelling in the legs or you have puffiness in the eyes, these are some of the things which can direct you at some point that there is some kidney issue which has started to set in. Now, as I go along in my slides, I will tell you how to test for it, just to be vigilant about it. And probably once every year, if you are above the age of 50, it's better to get it checked once, whether the kidneys are normal or not. So yes, so you don't need symptoms don't come until it's too late is not true. There are symptoms which can happen when even early kidney disease has started setting in. Now these two have clubbed together because they are diametrically opposite, but these myths also remain in the society. One is, oh, kidney disease is curable, so everything that happens will get settled down eventually and I will not need to follow up. Or the other extreme that, oh, once a kidney disease is there, it's completely incurable. Both of these are not true. As you can see, there is spectrum of how the kidneys get involved and hurt over a period of time. And so you should let your doctor know what your symptoms are and let them take forward which way the kidney disease is progressing. As I told you earlier, some acute issues like you were absolutely okay 10-15 days back and the kidneys have got hurt can be because of many reasons, and that is indeed curable. Even if it's a chronic process over a period of time wherein blood pressure or diabetes has starting affecting the kidneys, you can retard the progression. You can slow the progression of this chronic kidney disease eventually into a complete kidney shutdown over the years. And you can do that liaising with your dietitian, with your doctor, ensuring a healthy lifestyle, ensuring normal blood pressures and diabetes control. So there are, both the things are not true, to be very frank with you. And you should not be very, what do I say? You should not be, when you get a kidney problem, you should not think that, oh, it's just a matter of time. Now that the creatinine has started getting better, I need not check it and just forget about it because I am not having symptoms. That is also not true. And thinking that once you have a kidney problem, it's never going to get cured, that is also not true. Swelling in the kidneys, in the legs, means kidney disease. Now, this is a very, very common thing which is there out there in the society. I wanted to address this because there are 100 reasons why there could be swelling in the legs. But if you are aware, yes, that is one of the symptoms. So you should get yourself checked. But there are some common medications, some other causes like varicose veins in the leg. There are a whole lot of other things, a uric acid problem which can cause swelling in one leg more than the other. But yes, if you have swelling in the legs, it is always better to get yourself checked, but it is not always the case that that is always associated with a kidney problem. Next is you need two kidneys to survive. So you have had a kidney stone, your doctor has told you that one of the kidneys is now not functioning well, we feel it's become small. It's not something to be extremely worried about. You should be, like I told you, there are a lot of people who donate kidneys to their family and do really well. There are some of them who grow up and don't know that they have a single kidney. So even if you have one kidney, then you can survive your life just as well as anyone else. Another very important thing, drinking 8 to 10 glasses of water, 15-20 glasses of water flushes out the toxins and keeps kidneys healthy. While it is true that drinking more water will keep the kidneys well hydrated, we have seen patients who take it to the other extreme, who feel that the more the water they take in, the better it is for them. That's not true. You should let your thirst guide how much water you should take, because if you take too much water, it can cause some electrolyte imbalances, like the sodium levels can go down in some patients, and you kind of keep yourself engaged with, you become obsessed with trying to drink so much of water that it starts infringing on your quality of life. So you should find a common path. A good dictum is probably a 2-liter water intake during 2 to 2.5 liters during the summertime, but there is no hard and fast rule. Make sure you don't stay too thirsty. Again, having back pain means kidney disease. That's not true. You can have so many other causes of kidney problems. You can have a spinal issue, you can have other things going on. But yes, if you do have back pain, then you should get yourself evaluated. Another is, I don't have trouble passing urine, so there is no kidney disease. I've already alluded to this. You can have so many of symptoms, and just not having no trouble in passing urine does not mean that you don't have kidney disease. You could still have kidney problems. I can feel when I have high blood sugars or high BP, and I treat myself accordingly. This is something which I have encountered so many times, and I'm sure a lot of my colleagues will also agree with me, is a lot of our patients feel that I can sense when my blood pressure is high. I can sense when my body needs blood pressure medicines or diabetes medicines. I know how to deal with it. Also, it is normal to have high blood pressure as we age. So we do not need to take blood pressure medicines as we age, because this is just the age factor coming in. And I was surprised as well that 33% of people who were surveyed in a study said they stopped taking a drug without consulting their doctor. So this is something that you have to liaise with your general practitioner, with your family doctor, with your nephrologist. And as a rule, do not stop any medicines without proper guidance. Yes, there are very few situations wherein you might have to bring down the medicines, but as a rule of thumb, you should be very cautious, because if undiagnosed or uncontrolled blood pressure keeps going on for a long period of time, it can affect the kidneys as well. Other very common thing is, I'm sure a lot of you would have started thinking, oh, then we should get ourselves checked, and it might be a very long and a very costly process. Well, to be true, it's not. Yes, there are many tests to fine tune and understand what the kidneys are going through, but two simple tests, if you ask me, a serum creatinine, a blood value of the renal function test, and a urine routine should be enough to guide your family doctor and your nephrologist what's going on with your kidney as a starting point. And these are not very costly. All kidney diseases are passed on from generation to generation. There are people who think that that's not true. Yes, there are a few of them which are carried on as genetic factors, but not as a rule. All of them are not carried on. Again, very important, trying special vegetables, concoctions, over-the-counter pills can cure kidney diseases. In my humble opinion, in my very small way, if you can take home this message that it is always better to ask your doctor before you venture into anything fancy, because a few of them can be counterproductive. A lot of them are not FDA approved and we don't know what they contain. So it is better to be safe than sorry. Again, progression of kidney disease is inevitable. So if your creatinine has started rising, oh my God, it's going to absolutely be devastating for me. That's not true, because we have a lot of medicines, we have a lot of things in our hand as doctors, you as a person and your family support, which can help in decreasing the chances of the kidney disease worsening rapidly. So it is not inevitable. You can probably slow down the progression so that the report doesn't keep worsening over long periods of time. Another very important, stopping salt completely from the diet will help in improving blood pressure control. I think we take it too far whenever we talk about salt. A general rule of thumb is, if you take less salt, no taking extra salt in your diet definitely helps. But there are some of us who take it to extreme levels wherein we stop the salt completely, and it can again be counterproductive. Yes, eat less salt, but do not completely stop it. Sea salt and other salt substitutes are better options for kidneys. This is also a myth which is quite prevalent. Yes, if you do not have any other electrolyte imbalances, and after discussing with your doctor, you can, in certain cases, take some substitutes. But if you ask me in this forum, I would probably refrain from giving this as a blanket advice, because sea salt and other salt substitutes have a lot of potassium. And once you have a kidney problem, the ability of the kidneys to excrete that extra potassium can be counterproductive as well. I do not have extra salt with my food, so my salt intake is less. How many times have we heard this? And processed food, you are well aware, there are a whole lot of things in the supermarket which have hidden salt content in them, and you must be aware of them, because these are extra unknown sources of salt which are getting into your diet, which are exacerbating your blood pressure and in turn hurting the kidneys. Kidney stone means you will always end up with kidney disease. So anyone who gets a kidney stone, if the stone is tackled properly, if it is not causing any problem in passage of urine, then, and it is handled properly at the right time, then no, your kidneys can be salvaged and there are generally no long-term effects that happen. Dialysis or transplant are the inevitable consequences of all kidney diseases. No, as I told you, there are a lot of ways the kidneys behave. Just keep a regular follow-up, and these things can be pushed as far as we can. And in more often than not cases, we can make sure that this does not apply to you. It's just that you have to control the controllables, like controlling blood pressure, diabetes, as I have already told you, and keep a watch from your nephrologist. This is again a very important myth. Dialysis inevitably means end of life. It does not mean so. If you are a kidney patient and the creatinine does go up for any reason to a stage where you need dialysis, a lot of our patients all across the nation, all across the world are doing very well on dialysis. They have the options of home dialysis, they have the options of blood dialysis, of abdominal dialysis, and patients do really well. It's not the end of life in the 21st century. Once dialysis is started in the hospital for any reason, it has to continue lifelong. While more often than not, when the dialysis is started, it is because the patient was very sick or their chronic kidney disease has progressed to a stage where they have been started on dialysis. In the hospital, I mean, there are a lot of reversible factors as well. If someone comes in with a heart attack, if someone has had any acute emergencies and the kidneys have got hurt, starting dialysis does not always mean that you have to continue dialysis in these settings. So you must be aware of this. I will end here for the myths because I can go on and on, believe me, and pertaining to each and every aspect of kidney disease, there are a lot of myths. And the ones which I have not covered, which I would like to do at some point with a niche audience, is transplantation and its myths, vaccination and kidney disease myths, stopping your dialysis or decreasing the dialysis frequency if you are a dialysis patient myths, stopping the medicines myths, and inability to travel and enjoy life with dialysis or transplant myth. A one-liner, you can continue to have the same kind of life that you're having. Of course, you have to make sure that your dialysis is taken care of, or if you're a transplant patient, you're taking the medicines properly. But there is no reason whatsoever that you cannot enjoy your life or continue with your career if you are on dialysis or transplant. Now, quickly, for in next 5 minutes or so, because I have you as an audience, I will quickly make you aware of what kidney disease is, what you need to watch for before I close on. So if you have ever been told by your doctor that you have a weak, failing kidney or a kidney disease, or you have any kidney problem or a kidney damage of any kind at any point of time, or passage of protein in your urine, then you should be aware that you should keep a vigilance and probably keep checking your kidney function once in a while. Are you at risk? Just look at these things and you can ask yourself, do you have high blood pressure? Do you suffer from diabetes? Are you overweight? Do you smoke? Are you over the age of 50? Do you have a family history of kidney disease or do you suffer from other kidney diseases? If the answer is yes, then meet your family doctor or your nephrologist and take it from there. The awareness of having a kidney problem is the first step in preventing the progression of kidney problem. Yes, a lot of us want to self-manage ourselves. We want to read, we want to see texts. In the age of social media, we want to be aware of what's going on with us. And we completely agree with that because knowledge is power and is empowerment. You know what is going on with your body. You feel good. You know you are able to control the controllables. But please beware because there are a lot of myths, misconceptions out there as well. Do not hesitate to get in touch with your doctor. Keep fit and active, control your blood sugars, control your blood pressure, eat healthy, keep your weight in check, maintain a healthy fluid intake, don't smoke or get help to quit, don't take over-the-counter pills, don't take any painkillers without knowing that you have a kidney problem or not. Get your kidney functions checked out. And I leave you with that. Even if you have a kidney problem, a bend in the road is not the end of the road. And it is never too late to take control of your health. And it is never too early to take control of your health as well. Thank you.